It's just one little sensation. And it might be just a tapping or a pulsating sensation. It should never hurt. It should never go down your leg or up your back. It just should stay in that. And it's so low that you have to sometimes stop and think, do I feel it? And we don't have to make any changes to it unless your symptoms are not where you want them to be. If we have the ability to make changes if we need to, it doesn't tell you have to pee. It just helps to get that bladder to not be so crazy and spunky. It's the sacral nerve neuromodulation. There's 2 companies that do it. Our hospital supports the Oxonics, so I do have a QR code for the Oxonics. The other one would be Medtronics, and they have a great website. We used them for years until we switched over to St. Agnes, and their product was Oxonics. So I support both of them. I was raised on Medtronics, and I was actually I used to educate other people on how to use the device. So for this one, this is a 2-step procedure. Sorry, I couldn't find my support. So this is a 2-step procedure that's done at the hospital. You will find some providers that will do the first part in the office. We don't, because the success of the stage 1 or the first step of the procedure is the placement of this very thin little wire. And I don't know that you can see it, but the top of the wire, you have little sensors on it. And those sensors are what we're going to send a stimulation to get the bladder that's overacting to relax. Oxonics or Medtronics, the sacral nerve neuromodulation, is used for overactive bladder, urinary retention, and it's also used for fecal incontinence. So there's multiple things that this device is used for. Not that you have to have all of them, but at least some. Those are the reasons why we use them. So this wire is placed into, if you were laying down on your belly, and this is your tailbone and your pelvic area. We all have the same, whether we are a male or female, but and so you see all these little holes. They're literally there in your sacrum. And so you see the spinal cord is here. We're not going into the spinal cord. We're not going into any of the nerves. We're just going to place this little wire while you're asleep in this hole right here, the third hole, which is the sacral nerve 3. And we're going to attach that wire just to a little external battery and give you a trial for about 2 weeks, 10 to 14 days, to see if we can improve your urinary symptoms by 50%. So if you're peeing 16 times a day, we want to cut you back to 8. We want to make sure if you're changing 15 pads a day that we cut you back. Like, our goal during the trial is half of what you're experiencing. And that's because we have limited capabilities in a trial phase to program that first wire.
This is the demo unit. This
Yeah.
is going to give a little bit of efficacy. We got to make sure we're in the right spot. We got to make sure that we are actually heading in the right direction
before we move on.
Seeing an improvement before we actually do phase 2 of this.
Yes. So the thing is that during that time phase that we have support from the company. So you'll have a clinical specialist who will be calling to check on your symptoms. And the diaries at that point are very important because we need to prove that you had 50% improvement. So what will happen is I'll call you. You have Dr. Duncan, who we just say he's the mechanic of the deal. And then you have the company support that will also be calling you to check so that all three of us can get together to get this as a best trial for you as possible. If you have another device in your body, that is absolutely fine. It's actually this sacral nerve modulation was actually developed by the people who developed the pacemakers. So it is compatible. There's no interference with that at all. Then if it works for you and we have 50% improvement, we go on to the second stage. And during the second stage, there are a choice of 2 batteries that are placed. This one that looks a little bit smaller, it's really not that much smaller, but it is a little bit smaller. That one has to be charged by the patient. And so this little battery would be placed in your upper butt cheek in the fat tissue that we all have. And so it would be under the skin, just like a pacemaker's under the skin here. This would be under the skin in your upper buttocks. Because of the age of our patients who are doing this, it's not as easy to take a device like this that is your charger, where you see that it has the pattern of this little thing. You actually have to find the connection in your upper butt cheek to charge it. And to charge, it takes about 45 minutes. So Dr. Duncan in my practice does not use this one because we had to replace more of them because the patient had to charge them and they were having difficulty charging. So he uses this one. Same thing. The wire in the second part would be attached to this battery and everything would be under your upper butt cheek. And you get a little device like this. And as you can see, there's not much you can do on it. You can't hurt yourself. The only thing you could do is shut it off, the battery inside you, and then it's not going to work for you because it's shut off. Or you can turn it up too high and then you're going to get a sensation that's going to be uncomfortable. But most people don't have to touch it. They just bring it in when they come in to see us, or they only have to touch it if there needs some changes. And most of the changes we can do over the phone because we program things inside of it. It's not made of metal, so it doesn't have metal where you have to worry about anything like that. It's made of porcelain, the whole device. We can always find the battery and the wire in X-ray if needed, if we're worried that it moved out of place or you gained a lot of weight or lost weight or you were in an accident, God forbid, then, we can make sure that the wire is working. We have a master programmer that we can tweak and put new programs in and update things, and where you are limited to what you can do for it. So when everything is working and you're going through the trial phase and afterwards, you're going to feel a sensation somewhere in your pelvic area between your clitoris and your tailbone. If you were sitting on a bicycle seat, like not the banana bicycle, but the newer sporty bicycle seat. So it kind of goes into your groin a little bit or up in the front, but it's not that whole area. It's just one little sensation. And it might be just a tapping or a pulsating sensation. It should never hurt. It should never go down your leg or up your back. It just should stay in that. And it's so low that you have to sometimes stop and think, do I feel it? And we don't have to make any changes to it unless your symptoms are not where you want them to be. If we have the ability to make changes if we need to. It doesn't tell you have to pee. It just helps to get that bladder to not be so crazy and spunky. Okay. So, but the remote itself is very easy to use. If you were blind, you could still use it because when I press this button, it vibrates. So you would still be able to use because you can feel the arrow up, you can feel the arrow down. So that would still be okay to use. But most of my patients I see yearly. Sometimes I'm calling them because they haven't been back and they're like, well, it's working. Why would I come back? Because we really need to check that wire and battery and make sure that everything is staying functional for you. The batteries last for about 15 years, and then we have to change the battery. Rarely do we have to change the wire. The wire can be changed if there's a problem with it, but rarely, we probably do, I would say 60 patients or more a year, which is a lot, because it's a more advanced therapy and people are like, let me go through the other steps first. But it's really like when I turn it on, you just press the button in and then it's looking for my battery right now and it'll stop. And that just tells you the volume. See how it stopped? That just tells you the volume of how strong that sensation is. If you didn't feel it, you would turn it up and the bubble would go up. If you did feel it, if it was too strong, you would turn it down. If the only thing is if the radiology centers and the airport like you to turn it the battery all the way off to go for your testing or to go through the airport. So because there's no bubbles up at the top, I just shut off your battery inside of you. But this just tells me what program I'm on. And this one here just tells me that my device is working. Green means good. Everything's working. If I didn't touch this, if you didn't touch your remote for 20 seconds, the remote would shut off, but your battery would already be programmed to whatever it is that we set it to. And each battery and programmer is tweaked just for you. So somebody else might have, all the bubbles green when they turn theirs on, and other people might only have one. And, no one would ever know that you even had this. You would have a little scar in your upper butt cheek. If somebody was looking, it's probably about that big, and that's from the battery placed. You do feel the battery a little bit, like if you rub your hand over it, you feel it. But that's because it has to be surface enough that if we need to make changes, we need to connect to it. Rarely do we have to make it, revise the battery or move the battery, only if we have to change it for the 15-year mark when the battery. I have some patients who's lasted more than 15 years though. So that's a good sign too, that people aren't really playing with it.
That's great. And so is that the final, I guess, area that you would then focus on for these patients?
So then what we would do is start tweaking and layering their therapy. So do we need to restart a medication if we can't get them better? Do we need to add Botox to their therapy? Do we need to send them to physical therapy? We reevaluate and determine what is best to get this patient dry. The other options are, do we need a catheter? To either teach the patient how to self-catheterize or to use a catheter, to give them a break or some rest, and reevaluate to see if there's any new problems. I see patients with hemoglobin A1 or the hemoglobin A1C for diabetes, that's 14. Your diabetes is making you peak. And until you get that level down, we can't really change too much that's going to make you happy, because you got to look at outside of what else is going on. And do you have a UTI, like a urinary tract infection? That can still occur. Like we can't prevent that. And the older we get, the more likely we're going to have one. So, we might need to add something to prevent urinary tract infections, or, so it's a layered therapy. And again, because the body doesn't gain great muscle as we get older. So